But Arizona continues to fight the release of information on COVID-19 for all long-term care facilities. It's why ABC 15 and other news outlets are taking them to court. And on Friday, the state released a stunning new argument for keeping all this secret from you. They say it would hurt the businesses and then invoke the Hacienda rape case as an example. ABC 15 investigator Dave Biskobing broke the story, and tonight he reveals the state's hypocrisy behind this argument.
The Hacienda rape case, first exposed by the media, revealed an incapacitated woman raped by a nurse, impregnated, and then gave birth. Reporters then went to uncover wider spread failures within Hacienda. But Arizona's attorneys argue in response to our lawsuit, and this is their words, the publicity harmed the facility too much. But the state left some things out, including Governor Doug Ducey's own words and actions about Hacienda.
In the valley, more than 70% of COVID deaths are long-term care residents. And even though what happened at Hacienda has nothing to do with disease information and data, the state is using Hacienda as an example to argue that releasing facility names with outbreaks would likely cause substantial harm to the business's competitive position.
That is just not a good comparison at all. And it's just alarming that they even went there.
Dana Kennedy is state director of AARP Arizona.
We're fighting the wrong fight here. And in a time of crisis, you need better communication, not less communication.
Governor Doug Ducey and Health Department Director Dr. Kara Christ won't budge. And as part of the response to a lawsuit filed by ABC 15 and these media organizations, state lawyers based their Hacienda argument on this declaration filed by the Department of Health's number 2, Kobe Bauer. He cited several examples of what they claim are setbacks caused by the publicity. Hacienda experienced significant turnover among middle and upper management, but the state didn't include this. Ducey, in January last year, then taking the opposite side.
It's time for their entire senior leadership team to be replaced, and I think their board of directors should be terminated.
Moving on, Bauer claims Hacienda also experienced significant hostility and safety threats. There was even a shooting in Hacienda's parking lot, except the shooting had no connection to the rape case or news coverage. It was domestic violence.
Police say the former spouse was standing over the worker with a gun when she screamed for help.
In fact, because of the media attention, there were off-duty police at Hacienda who saved the woman's life.
Fired his handgun, struck the suspect, ended the threat.
These issues threatened the facility's ongoing viability. What isn't mentioned, after health department inspectors did more inspections, more issues were uncovered.
One of its residents was found with several maggots on him.
The state itself publicly releasing statements taking action on extremely disturbing incidents and inadequate care.
News, state health officials starting the process of revoking the license of Hacienda Healthcare.
At one point, when Hacienda didn't keep its promises about improvements, the governor spoke out again.
So I'm working with state agencies so that we can take the most aggressive action possible.
And Governor Ducey sent this letter to the Attorney General. It cites published reports about problems and asked for the AG to prosecute Hacienda.
I don't know, it seems like, it's worse than irony, it seems like hypocrisy to me.
I completely agree. And, you know, there's over 100 long-term care facilities that have COVID in it. And this is really a silent killer, and it's an invisible killer.
I'm investigator Dave Biskobing, ABC 15, Arizona.
So far, Governor Doug Ducey has not responded to a request for comment on this, but the health department released a statement saying, quote, the horrific events that unfolded at Hacienda were tragic, and the department took significant action to hold the facility accountable. Our brief in the pending lawsuit makes that point very clear. Our focus is not defending any misconduct by the operators of these facilities, but ensuring they can adequately protect the health and safety of the residents who live at those facilities.